Dr. Surender Mittal from Narnol. I am working as consultant physician and diabetologist in Samvedna Hospital. Today session is on diabetes and its complication and its impact on heart. As well as we will talk about the preventive measures for the people living with diabetes. As we all know, heart disease is the most common causes of the hospitalization in today's world. And the most common cause behind it is diabetes. And as we all know, raised blood sugars will impact the heart vessels, and it will form the atheromas, and that will block the heart, and that will cause heart attacks and MI. We all know people with diabetes will have twice likely as heart disease and stroke as compared to non-diabetic. And amongst one study suggests that diabetic people who are more than 65 years of age have chances of 68% of death from heart disease. Moving on to that, there is bad cholesterol and good cholesterol. Bad cholesterol is LDL cholesterol, and which raised in the body and which makes blood vessels prone to atheromas, which causes narrowing of the blood vessels, and that will result in the stoppage of the blood flow to the heart that may cause heart attacks. Diabetes is a lifestyle disease, and we can manage diabetes by significant changes in the lifestyles, and it requires a lifelong commitment from the patient. How we can prevent this, these complications, these preventive studies? First, you should know your ABC. ABC means you should know your A1C. You should know your blood pressure, which have to keep below 140 to 80, and you should know your cholesterol. And that in which cholesterol that we have discussed, LDL and HDL. As LDL should be below 70. And secondly, we have to eat healthy and very well balanced diet, right diet. That means we have to cut off our carbs, and we have to increase protein diet. We have to change our saturated fat to unsaturated fats, like we have to decrease ghee and butter to sunflower oil, olive oil, and all. And we have to change that breads, wheat breads and cereals to millets, dry beans and vegetables, green leafy vegetables and fruits and nuts. And we have to cut down the salt also, because increased salt intake will result in increase in BP. And so we have to try to remove the salt from the table, and we can use other foods like flavor to add the food, like herbs, black pepper and lemon to the food. So eat a balanced meal, eat a reasonable amount of calories, eat regularly at right time, and eat slowly. And try to maintain a healthy weight and engage in regular exercise. 150 minutes a week is recommended exercise per day. And obesity is now a multifactorial, and it's a burden to the country. So we have to control our weight also by changing dietary habits, by doing aerobic exercise like swimming, walking, etc. We should take medical treatment from the doctors, consult your doctor timely, and do change your medicines when it required. And second thing is that we have to quit smoking and alcohol, because smoking is the addictive factor to the diabetic patient to cause heart attacks in heart problems. So we should quit smoking. And lastly, stress. We have to cope with the stress by meditation, yoga, and all. Take sleep 7 to 9 hours per day, and manage your stress, manage your lifestyle. Thank you.